Today we have something very interesting. We have Mrs. Smita with us, who underwent a knee restoration surgery with bone marrow cells and PRP implanted into her knee in an arthroscopic surgery. Today it is 16 weeks after the surgery. We will explain to you her symptoms before the procedure and how she has improved 3 months after. Mrs. Smita, it's up to
Hi
you.
everyone. I was suffering from osteoarthritis like for the past 6-7 years. At a very early age, in fact, I had a lot of pain, inflammation on my knee joints, and my mobility was very bad. I used to wobble a lot while walking, and most importantly, I couldn't sleep at all. It was so painful. I couldn't turn to any side and sleep because both knees were very painful. I had inflammation, and I was so dependent on somebody even to go out, just to step out of the house, and then if I see an unleveled surface, it was so scary for me. Like if I step on the floor, like it shooting pain, I would develop on my knee joints, and I was like in a very bad state actually.
You're 48 now.
49 now.
You're
Yes.
49. Since when did your issues start?
I think it should have started around 40, 41. It started off with stiffness. Actually, it started off with stiffness. You sit for some 10, 20 minutes and you get up from the place, and you feel that somebody is holding your knees so tight, you can't move your legs. So it will take a few seconds for me to make one step.
So at this point, I would just like to share one thing. In orthopedic surgery, we have a textbook which we all of us use called Apley's. And I remember a line in that. The textbook says, just by wear and tear, in order to create the changes of osteoarthritis, it will take 200 years. So just activity causing the changes at 48 is not possible. You have some issue triggering the pain if you have pain at 40. It's not just activity.
Okay.
At that stage, if we had identified
Yes.
what it was and stopped it, your problem would not have even progressed this much. Okay. Now, coming to the surgery.
Yeah.
Okay. So you had an arthroscopic surgery,
Yeah.
and you had bone marrow cells
Yes.
and PRP harvested from your pelvis and your blood injected into the knee,
Yes.
injected into different parts of the knee actually, and also you underwent an arthroscopy
Yes.
of the knee where we washed out your knee and cleaned out all the extra loose bodies which were inside the
Yes.
knee. Okay, now what was your experience immediately after the procedure?
Okay.
Okay, and now see, many patients are afraid of pain, you know.
Yeah, I understand.
Bone marrow aspiration, pain.
Yes.
How was it for you?
Actually, the bone marrow aspiration part, I didn't feel any pain after the surgery or immediately post surgery or after 3 months. I don't have any pain in my back.
Very good. Yeah.
I never had any pain in my back. Yes, the arthroscopy part, I had pain. First 48 hours was like very painful. I was able to visualize the difference in 2 weeks, 3 weeks progress, 4 weeks progress. I was able to see the difference. Yes, of course, the first 1 week, if you are able to bear the pain, I would say for the 6-7 years of pain I underwent, I think this is nothing.
That is not too much.
Yeah.
Thank you so much for sharing your experience. I think a lot of patients want alternatives,
Yes.
but they're extremely scared.
Yes.
Yeah, so it is really, really good that you shared this. About pain, you know, the reason why we need to attack pain right away is pain is like an annoying friend you don't like at a festival.
Yes, sir.
It keeps stopping you from doing everything you used to love doing.
Yes.
And that changes who you are after a period of time.
Yes.
And that is the reason we need to attack any pain in the body as fast as we can. And I hope at the end of 1 year, we will again have a similar experience.
Yeah, one more thing I would suggest, like after after 2 months after surgery, the best part is that stiffness has gone. Around 70% of
Wow,
the stiffness has
fantastic.
gone. I'm able to get up from a place and just move. So that is one good thing that happened. And second is sleep.
Wow.
I am able to sleep at least 6 hours without pain. So there might be disturbances in sleep, but it is definitely not because of pain.
Yeah, so when you sleep better, you recover better,
Yeah.
you strengthen your body better.
Yeah. Yes.
And also, she exercises a lot every day and she is very good with her diet, activity control, and physiotherapy. All this
Yes.
put together with the procedure have given her
Yes,
this
I would
results.
definitely say all patients who undergo this, please focus on your exercise. Everything else can wait. If you have undergone this much pain and like I'm a housewife, so most of the housewives have the tendency to focus more on the family and less on your body.
That is the hardest job
Yes.
to do.
Yes,
Being
I
a
was-
homemaker is the hardest job to do. See, we
Yes.
come here, sit, do something, and go. There, you have to be awake, alert at all times.
Yes, I'm married
So-
for 29 years and this is the first time I'm taken 3 months for myself.
You should have done it much earlier.
Yes, yes,
Then
I
they
should
would
have. That's why I'm
happened.
saying
So, yeah.
whoever is undergoing this pain, if the doctor says you have to rest for 3 months and focus on only yourself, please do it.
I think
That is
that's
going to
fantastic
help
advice.
for the
I
rest
think
of your life.
I think I could not have put this any better. No,
Yes.
really, I think people should do that.
I understand a lot of women of my age still think that the priority is family and your health always seconds. So I've suffered so much now. I cleared my mind. Yes, I need to walk pain free. I need to be independent and free, like you said.
Yeah, so that you can be efficient in
Yes.
taking care of them also.
Yes, sir. They've all grown up now. So now I have to take care of myself and my husband, and it's going to be my old age where I can focus on. I want to be without pain, sir.
Okay, see,
That's the only
old age is a matter of mind.
I
At
know.
90, you can do a marathon.
Yes, sir,
That's
I
how I
see.
want you to think.
Sure, sir.
Okay?
I hope with your help I'll be
Absolutely.
passing that stage also.
Okay.
Thank you
All
so
right
much,
then.
sir.
Thank you so much once
Thank you,
again.
sir. Thank you so much.
Fantastic.